Now, if the extramedullary hematopoiesis has to be set into motion, that means when we require to produce more RBCs, there is some destruction going on, or there is some other reason when we are required. So other structures are recruited, that is called extramedullary hematopoiesis. Now, basically, this occurs in sites which are outside the marrow, and this commonly occurs in hemoglobinopathies, especially in cases of thalassemia or in other conditions like myelofibrosis. This picture is very classical of a patient of thalassemia. The faces of a thalassemic patient, they are called chipmunk faces. Chipmunk is a animal which is shown on the in the slide. So it's a squirrel-like animal. So what basically is seen in this patient is the bossing of the skull bones, pinched nose, and large malar bones. Along with that, of course, there will be anemia, pallor will be there. If we look at the lateral X-ray of these patients, the lateral skull X-ray of these patients, there is a spiculated appearance between the two diploid bones, which is called a crew cut appearance. Crew cut is a typical haircut which is given to crews, and that X-ray also resembles the same thing. If we take history and examination into consideration, anemia can have many reasons. There are many causes of anemia. We have to go in a stepwise manner. There can be problem inside the RBC or outside the RBC. So we have to go in a stepwise manner. So certain disorders may be associated with anemia. Nutritional anemias are very common, so we must take that into consideration. In young children, the ankylostoma duodenale, that is the hookworm infestation, is another very common cause of anemia. In young females, menstrual blood loss is an important cause. Bleeding from the upper GI tract, which may be evident to the patient or may not be evident to the patient, is also another important cause. When the bleeding is not evident, it is called occult blood loss. So all these are important causes. There are certain diseases which may lead to anemia because of chronic, it's called the anemia of chronic disease, like diseases like chronic infections, like tuberculosis. Then autoimmune diseases, chronic autoimmune diseases like rheumatoid arthritis can lead to the production of cytokines, etc., which can shut the production of RBCs, cancers, and other. These are the causes. Anemia may be associated with lymphoproliferative disorders and leukemias, lymphomas. These can also lead to. We must check the geographical location of the patient because there are certain anemias which are confined to certain geographical locations, like for example sickle cell anemia may be found in certain belts. Hemoglobinopathies like thalassemia are found in certain ethnic groups. So G6PD is also found in certain people, living in certain areas. So this also must be taken into consideration. History of toxin ingestion, then history of infections like malaria, which are rampant in some portions of the country, and ask for history of blood in the stools, which you may have to confirm if this blood loss is less with stool for occurring blood. As far as the examination goes, we must look avidly for signs of nutritional deficiency. For example, iron deficiency anemia may show a pale and a barred tongue. There may be koilonychia, there may be platynychia. So these kind of things must be taken into consideration. Then vitamin B12 deficiency may present with neurological signs in addition to anemia. There may be lassitude, there may be dementia, there may be neuropathy, there may be spinal cord signs. especially of the posterior columns and the upper motor neurons. So all those things can be there in advanced cases. And in addition, the B12 may show a beefy tongue, chelosis, etc. Then a presence of lymphadenopathy is important to rule out lymphoproliferative diseases. Splenomegaly and hepatomegaly also will give us a clue about a cause of anemia, maybe a lymphoproliferative disease. Petechia, they are a very, very important portion of the examination of the patient because they give us a clue that probably all the cell lines, not only the RBCs but other cell lines like platelets, etc., are also decreased. So in cytopenic conditions, a petechia will give us a clue. In other than that, an anemic patient may have a effect on the heart. There may the pulse becomes strong, the cardiac output increases, the patient is having sometimes the flow murmurs are there, which are systolic murmurs, these may be seen. So these are basically the signs and symptoms which we should look at the general physical examination. Here we can see a normal conjunctiva which is pink in color, but if we see in a case of pallor, it will be slightly whitish in color. The nails are also similarly, they may show white color. In fair patients, we may be able to see this sign that sometimes the palmar creases, maybe the color of the palmar creases may be lost. These are the colors of the tongue which inform us about the anemia. Besides this, we can look at the tongue. We may find a beefy tongue, indicative of B12 deficiency, or a pale and bald tongue, indicative of iron deficiency.